Hi, my name is Dave, and I'm going to be doing teaching on the heart. Basically, just what the heart is, its conduction system, and then I'm going to talk about some heart arrhythmias or dysrhythmias. First of all, I'm going to start off. The heart, of course, is a muscular organ that consists of 4 chambers, 2 upper chambers called the left and right atrium, and 2 lower chambers, the left and right ventricles. The heart consists of a conduction system which starts in the atria. In the right atrium, there's a sinoatrial node, or the SA node, where the conduction starts. That conduction travels through both the atria, causing the atria to contract and to force blood down into the ventricles. Then that electrical conduction travels to the atrioventricular node, or the AV node, and then it continues down through the bundle of His into the Purkinje fibers, which is in the septum between the ventricles and in the ventricular walls. And it travels down the septum into the Purkinje fibers and up into the ventricular walls, causing the ventricles to contract, forcing the blood through the body into the lungs. Some of the arrhythmias that can occur with this conduction system are atrial fibrillation, atrial flutter, ventricular tachycardia, and ventricular fibrillation. I'll start with atrial fibrillation, which is basically when the conduction system up in the atria is conducting chaotically, which is causing the atria to basically quiver at a rapid rate, thus not optimally pumping blood down into the ventricles. And when this happens, it can cause the stasis of blood in the atria, which can lead to the formation of blood clots, which could cause an embolism. This is treated, or can be treated, with medications. There are some surgical procedures that can treat it, and also pacemakers. Atrial flutter is similar to atrial fibrillation in that atrial flutter basically is a rapid conduction through the atria, but instead of a chaotic quivering of the chambers, there is a regular beating, just very fast, up to 240 to 340 beats per minute, which causes also the ventricles to increase their conduction and contraction rate as well. And symptoms of both flutter and fibrillation can include fluttering in the chest, weakness, fatigue, chest pain. And moving on to the ventricles, ventricular tachycardia is when the ventricles are contracting very rapidly. And this can happen normally with exercise or for other reasons causing this arrhythmia, which can lead to ventricular fibrillation, which is a deadly rhythm, basically in which the ventricles are quivering and not moving any blood whatsoever through the body, which can cause sudden cardiac death. And that is something that needs to be treated immediately, since it can cause death quite quickly. And these can be treated with, again, with some medications. There's the use of pacemakers or ICDs, internal cardio defibrillators, or cardioversion and defibrillators, which when it notices the heart is out of rhythm, will shock it back into rhythm, or if the heart stops, shock the heart to start it up again. And that ends my presentation.